Good afternoon, it's Mark Larson. It's Monday. I hope you all had a good 4th of July weekend and made sure that you stayed safe. We continued to be very busy here at Public Health over the weekend. We had 17 new cases. Those cases, for the most part, were due to people doing things that we normally would consider as normal activities. Things like graduation parties, things like birthday parties. Anytime we get together with others, even though we can get together in groups of less than 50, the more people that are together, the closer we are together, whether we're indoors or outdoors, all has an effect on whether or not we get COVID-19. So our numbers are going up. It's not just due to more testing. Our percent positives are also going up. And currently, if we were to be applying to go into phase 3 today, we would not qualify to go into phase 3. So that doesn't mean we're going backwards out of phase 3, but it does raise a lot of red flags in regards to what we're out doing. So that's why every day, what I say is wear your mask, stay 6 foot away from others, and stay home if you can, because that's how we're going to keep this disease low and allow us to continue to move forward. So we do not currently have any patients with COVID-19 in the hospital. Our patient that was in the hospital last week went home and is recovering well, although still is not back to their normal self. And I'll go to questions. So I'm going to read the questions like I did the last time. I had a serious cold last November with a temperature, etc. I would like to be tested for COVID antibodies. Where can I get this test? So your primary care physician can order that test for you. It is tricky. Out of 28 COVID antibody tests that have been done at KDH this year, we've only had 2 that were positive for antibodies. So that doesn't mean you didn't have COVID-19 in the past. Antibodies go away quickly. So currently, they're not super helpful for those people as an individual, but they are helpful for us from a public health perspective. So if you want to go to your physician, they can order that test. You need to talk to them. Next question, would like to hear your opinion on the decision to move to Yakima to phase 1.5. So Yakima has been in phase 1 for a long time. They had 113 cases yesterday and 4 new deaths. There are questions, like there were questions here, businesses that said people can go to box stores, why can't they go to a small shoe store, and those type of things. So the decision was made just like in Benton Franklin, well, to allow Benton Franklin to move into 1.5. I believe, according to your question, that that's the case in Yakima too. It's a risk. It's a risk for us moving into phase 3, but it's a calculated risk based upon the state to allow some businesses to get open again. I think those businesses are going to do a good job of safety, and with the governor's new masking mandate in place, that's going to be helpful too. Why are there so many pending cases? So probably the answer to that is because things are really ramping up in the south. So in Texas, California, Arizona, Florida, the lab we were using, LabCorp in Arizona, was getting 100,000 tests a day. So they were overwhelmed. All of the labs are overwhelmed. So we have about 200 tests still pending, and it's taking about 5 to 6 days to get back. So that'll get better, but it's a lot of work to try to figure out how to do labs. And we know that there's going to be more labs done in the future, including testing nursing homes, assisted living facilities, and the like. Why aren't stores enforcing the masking policy? I think they will now that it's under labor and industries. I saw in the Yakima paper today that labor and industry was fining a gym that was not supposed to be open in phase 1. So I think as stores realize that they will be fined by labor and industry if they don't enforce the governor's masking mandate, that we'll have more compliance with that. Next question is about stay-at-home order. So we have a county health order. We've had it since the beginning. That allows us to protect members of the public. It's similar to what the governor's order is, but if the governor would decide, I think that this is not necessary anymore, or perhaps even legal, we have some legal grounds to help keep people safe. So our health order is consistent with the governor's current standard. The question asks about, we can go about our non-essential businesses under full phase 3 activities despite an uptick in cases. If our numbers keep going up, we will be rolled backwards, or we will have something happen like what happened in Arizona or California, where bars were closed, and I saw that restaurants were closed in Florida today, and those kind of things. So people need to take some personal responsibility, and just because we can go out to a large gathering of less than 50 people doesn't mean that we should be going out to those things. So so we are not testing. The question was about masking and whether or not we were collecting data on whether people were masked. So I would say my gut feeling is, because I have done some of the case investigations, but not all of them, some people are wearing masks, some people are not. We've had positives that were asymptomatic, that were out in public at businesses, at job sites, and some people that were symptomatic at those places. We've had people that are asymptomatic that were positives, but they got checked because they had a relative that was symptomatic. And so we're still trying to protect those people that are at highest risk, the folks in the nursing homes and long-term care facilities. We're trying to protect healthcare workers. And this last weekend, we had a 21-year-old college student at Penn State who died. And we need to remember that even though college students have less severe disease, they don't have, they're not without risk. So we're trying to open Central up to athletics. We're trying to open Central up to have students back in the fall, and we're trying to get the K through 12 schools opened, and that requires us all to be responsible. We can do case and contact investigations. My ask of you is that if we call you from public health, we're just trying to protect others. Please cooperate with the folks that are asking you questions about where you've been and those type of things, because if you were at a facility that had older people, for example, we would want to know that so we could make sure that those people are safe. So take care of yourself, wear a mask. When you go in a store, it's now the law. And if you're out and about, make sure that you're staying more than 6 feet away from people. And if you can't, then you need to wear a mask. So we will talk to you later this week. Thanks a lot.